Okay, folks, so why don't we get started? I just checked my email to make sure that no one else was having trouble coming in. Thank you so much to everyone who is joining us for this, this virtual session. My name is Jean Herb, and I reside at the Rutgers University Blaustein School that some of you may have an affiliation with, because besides being the university's community planning and public policy school, as well as we offering a public informatics program. The Blaustein School offers a graduate program in health administration and the undergraduate program in public health. So some of you may have affiliations for that reasons. I also co-direct the New Jersey Climate Change Resource Center with my colleague, Dr. Marjorie Kaplan. And the Climate Change Resource Center, which Marjorie, I'm asking if you could put the link for it into the chat, is a really interesting phenomena here in New Jersey that we hope you'll become familiar with. So about 2 years ago, the New Jersey legislature passed a law to create the Climate Change Resource Center, houses at Rutgers University. And the concept is that the Resource Center brings the capacity and the expertise of the academic community to support advancing sustainable climate solutions here in New Jersey, both with regard to preparedness and resilience, but also with regard to reducing the emissions and the pollution that causes climate change. So the law that creates the Climate Change Resource Center directs us to work closely with state and local decision makers and policymakers to develop tools and guidance that can be used to address climate change, to build capacity through things like training, to work closely with vulnerable populations and public health officials like yourselves, as well as vulnerable populations. So it's a really interesting kind of model. And we hope that if this is your first touch point with the Climate Change Resource Center, that you will consider us as a resource to you. Think of us as a climate service center, I think is maybe a good way to think about it. So today I'm joined by my colleague, Marjorie Kaplan, who co-directs the Resource Center with me at Rutgers University, and then also a number of my other colleagues at Rutgers. So Dr. James Shope, who is our applied climatologist, Lucas Markson, who is the Associate Director of the Office of Research Analytics, Lucas's colleague, Michelle Stewart, who keeps our data tools up and running every day, and Pritpal Bamra, who is a Senior Research Specialist and Community Planner with the Climate Change Resource Center. So that's the team that we have here today. We've set this up as a Zoom meeting as opposed to a webinar, which means that all of you can at any point unmute if you want to ask a question, but you can also, in addition to doing that, use the chat to put in questions, and Marjorie and Pritpal will be monitoring the chat. Our hope is that this session is something that is more of a conversation than just a one-way presentation, although we'll be doing some presentations with you today. We've built the agenda for today in a way that has lots of opportunities for us to pause and take questions with all of you. And so please take advantage of that. And please don't be shy about asking questions as well. What we're going to be doing today is we kind of have three parts to this session besides listening to me right now. Next, I'll be turning it over to James Shope, who's going to give you all a Climate Change 101, as well as a brief presentation on impacts here in New Jersey to public health from climate change. So that's kind of to get us all on the same page. Then we'll turn it over to Lucas Markson and Michelle Stewart, who will be walking you through some of the free web-based climate tools that we have available for your use. That's going to be very practical, so that we'll be presenting to you some tools, some data, some functions that you can access, and we'll open it up for lots and lots of questions. And our hope is that you will, in the days and weeks to come, play around with those, and we're going to be looking for opportunities to continue to engage with you. And then we're going to finish up with taking a little bit of time to listen to all of you. We develop these data tools and this guidance that we put together to serve you, and we want to hear from you as to what else you might need, what kind of data do you need access to, what kind of guidance do you need access to, what kind of technical assistance do you need to be able to use these tools. So we really want to hear from you so that we can improve the work that we're doing, both in terms of data, but also in terms of trainings and guidance. So that'll be an opportunity to kind of open up the discussion and hear from all of you a bit. So that's kind of the game plan for moving forward. One last thing I want to say before turning it over to James is that we've come to this place in terms of development of these data tools, this guidance that we'll be presenting to you, but through lots of different means, but one of which is by engaging with the public health community. So starting as far back as about 10 years ago, we've held a series of different focus groups and stakeholder listening sessions with the states, with New Jersey's public health community. We view the state's public health community as leaders on issues associated with addressing climate change, because we know that climate change is a public health emergency. And we've heard loud and clear from all of you as to support that you need to better position the public health community into that leadership space. So this was not work that we've done of our own accord. This is work that we've done as a result of listening to all of you. And so we hope that what we'll be sharing with you today is helpful. And we hope that this is the beginning of more conversations about how to provide support to the public health community. So Marjorie, before I turn over to James, is there anything that you want to add? No, we're good? Are there any questions from our participants? Oh, I know, I have to mention CEUs. So if you successfully got yourself on this registration and onto this webinar, it means that you negotiated the registration site, and that means we have recorded who you are. And if you're requesting CEUs, it also records your CHES number. What we'll be doing after this training is we will be sending all of you a Google survey just to get your input on this session, which is also something that's required for you to be able to receive your CEUs. And then we'll be passing along your names and CHES information to the School of Public Health that provided us the support to be able to create the CEU arrangement.
Jean, I did want to add one thing. I thought it might be nice if we can see your names, but we don't know your affiliations. And it just might be nice if folks typed in the chat their name and their affiliation. And there's two folks that are on the phone if they might not be willing to identify themselves. There's an 845 person and a 973. So maybe they could unmute themselves. The 845 person could tell us who you are.
Okay. Yeah, that's great.
Because it would just help us, I think, in the conversation. This is informal, so.
This is informal. Anybody on a phone want to unmute and tell us who you are? And for those of you who are joining us via Zoom, please type your name and affiliation in the chat. Again, we have you registered, but right now this will help us as we know who we're talking to. Again, you can unmute. You can put questions in the chat or comments in the chat, but if one of us is talking and you're like, wait a minute, I don't understand that, slow down. You are welcome to unmute and ask a question or ask for clarification. So again, this is a bit informal, but we thought this was the best way to present this information. Good.
Hi, I just unmuted. Can you hear me?
Yes, I can.
Yeah.
Wonderful. I'm the 973 number. I'm Michael Hodges. I'm a health officer and a health educator here in New Jersey. I've worked at a number of health departments throughout the state, but now I am working for myself as a consultant, strategic health advisors. So this has always been a fascinating topic to me, especially considering the summer that we've had and looking at all of the natural disasters that have occurred in the last 3 or 4 months around the world. So I'm looking forward to this. I'm also a Ches, so I'm here for credit as well, but very much interested in the topic. And thank you for providing the training.
Thank you so much, Michael, and we're happy to give you credit. So thank you so much. Okay, so I'm going to turn it over to my colleague James Shope, who's going to give you a climate change 101 impacts to public health in New Jersey 101. James, I'll let you take it away.
Yep, thank you very much, Jean. I'm going to share my screen here. So let me know if this pops up for you. Okay, so as Jean mentioned, I'm just going to go over climate change kind of broadly, some of the past trends here in New Jersey, some future projections, and just some implications for health and public health. Not specifically targeting individual locations in the state, but just kind of broad scale changes that we expect to see. So first, let's go over just climate change itself. So climate change is driven by the combustion of fossil fuels, so coal, petroleum, and natural gas, which emit greenhouse gases into the atmosphere. Those greenhouse gases drive climate change, and of which carbon dioxide is kind of the largest component of that total amount of observed climate change. So in this graphic down here, we have the concentration of carbon dioxide in the atmosphere as measured at Mauna Loa Observatory in parts per million. And we have measurements there ranging back to the late 1950s. The red line actually represents the measurements, and the black line here represents just the general fit through that. What you can see is that the concentration of carbon dioxide in the atmosphere has been increasing over this time period, and that this curve is slightly bent upwards, which means that not only are emissions increasing, but they're increasing at a faster rate. So currently we're sitting at above about 415 parts per million, and I believe earlier this year we exceeded 420 parts per million. So we care about that increase in carbon dioxide and greenhouse gases because they drive warming. Here we have an image from the IPCC, so the Intergovernmental Panel on Climate Change, relating global surface temperature changes to pre-industrial conditions. So that's what this 1850 to 1900 is. The black line represents our actual measurements, and global temperatures have increased since 1900 to the tune of about 2 degrees Fahrenheit. So about 1.1, 1.2 degrees Celsius, which is what this is in. And as our carbon emissions change over the future, we expect the world to continue warming. So the IPCC provides a number of scenarios based on our emissions pathways to how much warming we would expect to experience by 2100. They're broadly in 3 categories. We have this blue category here, which represents a reduction in our greenhouse gas emissions and therefore a smaller amount of warming compared to this pre-industrial scenario here. These red scenarios, which represent kind of unmitigated greenhouse gas emissions, and they relate to a much greater amount of warming. And then we have this kind of gold scenario here, which is for moderate emissions, and it's the one that we're most closely tracking with our current global policies. It's important to note that this is a spectrum. We're not locked into any one of these. They're just scenarios for illustration of how the future could evolve. And that warming leads to a number of detrimental effects around the globe and here at home. We expect to see stronger coastal storms leading to greater amounts of flooding and damage. We expect to see changes in precipitation patterns in certain locations, resulting in higher frequency or greater amount of flooding in certain locations, drought conditions in other locations, threatening water resources, and drier conditions in certain locations, leading to more wildfires and the resultant air pollution from an increase in wildfire number. So that's kind of the global scale overview of climate change. So let's actually focus in on New Jersey itself, and we'll start looking first at temperature and heat. from temperature and heat, everything else is kind of derived in terms of climate change. Temperatures in New Jersey, much like across the world, have been increasing since we have, as far back as we have measurements for. So we have measurements back to the late 1800s. This graphic shows temperature in Fahrenheit here. The mean of the last century is this black line. The actual measurements are this orange line and dots. And then the green line is just a simple fit through it so we can see the trend more easily. A few things you'll note. One, temperatures have increased in New Jersey. In fact, our temperatures since 1900 have increased by about 4 degrees Fahrenheit, so roughly double the global average. And that since about the 70s, 80s, our temperatures have been increasing at a much faster rate. So we see that this line here is at a much steeper angle. In fact, our rate from 1970 to today is about twice that of the rate of the entire time frame. So our temperatures are increasing, and that temperature increase is accelerating. And when we look to the future, we turn to climate models to help us figure out where our temperatures could be by the end of the century. So I'm changing our baselines a little bit back and forth, but it helps elucidate some of our trends here. This is now temperature change in Fahrenheit relative to this black line, which is the mean from 1900 to 1960, so the first half of the last century, basically. The orange line represents our actual measurements. The gray region is model reconstruction of that. You can see it fits pretty well. And then we have this green and red here for lower greenhouse gas emissions and higher greenhouse gas emissions, respectively. And a couple of the takeaways you'll see immediately is that we are planning for a warmer future here in New Jersey. Even with lower emissions, we're still expecting temperatures to be about 2 to 8 degrees warmer than this baseline period here. With higher emissions, they're about 8 to 14 degrees warmer. So we can change our trajectory based on global climate emissions, but we're still going to see a warmer future. But let's put that into words and discuss like implications. So with that higher greenhouse gas emissions trajectory, that red trajectory, we expect by the middle of the century, 70% of our summers are going to be warmer than any before 2006. And by the end of the century, so around 2100, about 90% of our summers are going to be warmer than any before 2006. Now, if we change and follow that green trajectory a bit more, those percentages drop, but we're still expecting to see a lot of superlative summer temperatures. And they'll be bringing with them more extreme heat, more heat waves and the like. And with that, we expect to see instances of heat-related illness, hospital admissions, and deaths amongst vulnerable populations within the state. Part of that is driven just by the pure temperature increase, but the other part of it is driven by changes in humidity. So as the atmosphere warms, it can hold more water vapor. And what that means practically is it gets muggier and humidity increases generally. And from an individual perspective, we cool off by sweating. Basically, we sweat, that evaporates off our skin, that cools us off. The higher the humidity is, the less effective that process is. So we expect into the future to see greater heat stress risk amongst individuals who are maybe more vulnerable, such as older populations, and where we see more humidity. Compounding this problem is less efficient cooling systems. Basically, during an extreme heat event, building cooling systems can become overwhelmed. So, you come inside to escape the heat, you don't get as much reprieve, and you're still exposed to high temperatures for a long period of time. Maybe cooling centers themselves are not as effective in terms of our planning effects. And these extreme temperatures we expect to be amplified in our urban sectors. We call this the urban heat island effect, but it also affects suburban communities. And it's effectively where you have a high concentration of impervious surfaces, so pavement, concrete, the roofs of buildings, and they absorb solar radiation and then re-radiate it out as temperature, or as heat rather, and causes the local temperature to be warmer than surrounding regions. So that's what's pictured in this graphic here. In this case, the city itself is several degrees warmer than the surrounded forested or rural locations. In New Jersey, we have a number of urban and suburban areas, especially along the Philadelphia to New York corridors. So it's important to consider that as a heat vulnerability aspect moving forward. Now, those heightened temperatures have a number of other detrimental effects. First, certain pollutants like ground level ozone are generated on really high heat days at a higher rate. So we expect to see a degradation of air quality that's bad for people with asthma or other respiratory illnesses moving forward. We expect to see an increase in prevalence of certain vector-borne diseases. So certain pests like mosquitoes and ticks, their range is dictated broadly by temperature. As the world warms, as New Jersey warms, we expect to see the range of those particular pests expand, as well as the diseases like West Nile virus and Lyme disease that they bring with them. We expect to see an increased water demand. Broadly, the warmer it gets, the water cycle kind of accelerates, and we expect to see more evaporation. So that can affect water resources within the state for use in agriculture and the like. And as temperatures increase, people turn their ACs on, and that pulls more electricity, and it can stress the power grid. And while we haven't experienced it yet in New Jersey, one of the worries moving forward is that we can overstress the power grid, causing interruption to service on really hot days, interrupting air conditioning usage, and reprieve during extreme heat events for people. Okay, so that's temperature. Now let's talk about sea level rise. I'm just kind of going through the big categories of climate change impacts here. So global sea levels have been rising. Here, again, we're turning back to the IPCC, and we're now looking at change in sea level relative to the year 1900 in meters. You can see that over here on the left. The black line represents our measurements, and what you can see is that global sea level has been increasing. This curve is a little bent upwards, which indicates that it's increasing at a faster rate in recent decades. And when we think about what's going to happen in the future, we again turn to our warming scenarios, which are shown over here. Now, again, broadly, the blue corresponds to reduced warming, and therefore, in this case, a smaller amount of sea level rise. The red, more warming, a higher amount of sea level rise. And then I said that we were following most closely this gold scenario here, which puts us at about 3/4 of a meter of sea level change by 2100. The IPCC also includes this dotted line scenario that's really low likelihood, high impact, because it's just plausible enough to include it. But it's better to focus on this suite down here in terms of what our likely global change in sea level will be. But that's global change. It's not necessarily the experienced sea level change here in New Jersey. So we have global sea level rise, which is literally an average of the world ocean and how it's changing. But then we have relative sea level rise, and that's how you experience sea level if you were, say, standing out on a beach for 40 years. How would it look for sea levels to rise compared to where you're standing? And what we find is that experienced relative sea level change is different in different parts of the country and different parts of the world. This graphic here shows the experienced sea level change, so relative sea level rise from 1960 to 2020 across the US. And you can see here in the Mid-Atlantic and in New Jersey, we've experienced more than 8 inches of sea level change, which is faster than parts of the country such as Florida or even California. Or if you go up to Alaska, it actually looks like sea levels falling relative to the land surface. So broadly, what's happening here? Well, you have global scale effects that cause global sea levels to rise. And that's primarily due to a warming atmosphere, melting glaciers and ice sheets. That water funnels into the ocean, fills up like a bathtub. And then you have just the warming of the ocean itself. As the ocean warms, it expands. Just like the materials in your house during a changing season causes it to expand and contract. Same with the ocean. As it warms, it expands, and we notice that volume increase as a rise in sea level. You have some regional effects as well, but here in New Jersey, we have local effects based on our vertical land motion. Basically, it's our land rising or sinking over time that exacerbates our sea level rise experience. So our coastal lands in New Jersey are sinking or subsiding over time. So what you have is global increase in sea level. You have New Jersey's land decreasing over time, And we have a higher amount of experienced sea level change within the state. Now, you go over to Alaska, it's a bit of a different story. Global sea level is rising, but the land surface in Alaska is increasing at a much faster rate. And that causes an experienced decrease in sea level relative to the land surface. So it's a little finicky, but it's all just to say we're experiencing a very high amount of sea level change here in New Jersey. And looking towards the future, that's only going to increase. Here we have an image for moderate greenhouse gas emissions, changes in sea level relative to the year 2000. The graphic's a little complicated, but the really simple way of thinking about it is everything within this tan region is our likely range of sea level change relative to the year 2000. And then the red line is our median estimate, or kind of our best guess at where sea level will be at that given year. So, for example, in 2100, we expect the likely range of sea level change to be between 2 and 5 feet above the year 2000. And our best guess is about 3.3 feet, or conveniently, it's about 1 meter. And that has a number of detrimental effects in terms of public health, damage to property, and the like. But the primarily most damaging and most expensive problem to deal with is the impact of sea level rise on storm surge flooding from big storms. And this graphic kind of explains this process. So here we have a house on land, and during existing high tide, it's protected. And say a hurricane or a nor'easter comes through. It generates storm surge, which is the vertical elevation on the water surface due to the storm effects, winds, pressures, and the like. And that's what's pictured here in this middle panel. And you'll notice that the storm surge stacks just on top of that baseline. But in this case, the house is still protected. Now, with sea level rise, you take that initial baseline here and you shift it higher, such that storm surge is now acting on a higher baseline, and it's able to penetrate further inland, and it's able to drown certain areas more deeply, and the house is impacted. So we would expect to see greater incidence in property damage, number of impacted people, damage to infrastructure, and the like. And to some degree, we've already seen this here in New Jersey. So a study from last year estimated that about 13% of the property damage from Hurricane Sandy can be attributed to human-caused sea level rise. The storm surge extent is pictured here in blue. And broadly, because sea levels were a bit higher because of anthropogenic effects, Sandy caused about $4 billion more in property damage in New Jersey. That's also many more people displaced. It's many more people harmed during the storm itself, and having to coordinate relief efforts and the like. And if we think about the future, we expect that today's 100-year intensity coastal flooding event. So a flooding event with an intensity that we would expect to see once every 100 years, or it has a 1% chance of happening each year. We expect that to occur about 5 times as frequently by 2050. And that's simply due to the fact that sea levels are higher, so you don't need as big of a storm to generate the same level of flooding. A smaller storm will give you the same amount of flooding. So again, a higher rate of those impacts from coastal storms in the future. Okay, so now I want to talk about precipitation and storms, especially in the wake of Ida last year. So total amount of rainfall in New Jersey has not changed very much since records began. Here we have the total annual precipitation on average here in New Jersey. That's dictated by the green line. And then we have means per decade, that's in the black bars, just so we can look at the trends. So if we were to look at the actual trend over time since 1900, we've had about a 7% increase in the amount of rainfall. So not much. But we do have a high year-to-year variability in rainfall. You can basically see that this graph is very spiky. And in recent decades, it's become even spikier, showing large swings between a high amount and a low amount of rainfall within the state. So we can see those trends, but there's not much going on here with just the total amount of precipitation. But there's a much stronger story with extreme rainfall within the state. Extreme rainfall in New Jersey has become and is becoming more frequent and larger. And a simple way to look at this is just with the number of 2-inch precipitation days, basically the number of days that we have received 2 inches or more of rainfall within New Jersey. And that's what this graphic on the right here shows. We have the actual measurements as these black dots in line. The average to the entire thing is this red line, as this black line, and then 5-year means as these green bars. And except for this last period here, we've seen an increase generally in the number of 2-inch rainfall events within the state. So think of it as extreme rainfall. And if we look towards the future, the state DEP worked with Cornell last year to publish information about how the 100-year 24-hour rainfall event. So basically the amount of rainfall we get in 24 hours with an intensity we would expect to see once every 100 years, or has a 1% annual chance of occurring. By the end of the century, we expect that rainfall to be 2.5 to 10% greater in central and coastal New Jersey and 20 to 25% greater in northern New Jersey. So from a practical perspective, this means we're expecting a lot more rainfall in the future with a lot more intensity. So when we look towards guidance for extreme rainfall, we need to look at those historical observations and consider them, but also think about them as needing to be supplemented by model projections and thinking about the future. So the effects of this extreme precipitation are pretty well known. You expect to see loss of life and property and infrastructure damage. For example, last year we had Ida that caused a huge amount of property damage, a lot of flooding, and took 30 lives within the state. Another thing that we don't consider as much following a large flooding event is how the floodwaters themselves are pretty dirty. They can contain human waste and the like, and they can contaminate food and water supplies. So if you're relying on food and water supplies to help recover after a particular event, if that intersects with your stormwater, it is basically useless. We also have an issue here in the Northeast with combined sewage overflow systems. Broadly, a lot of our sewage systems are set up such that our stormwater is combined with sewage. They're basically funneled into the same pipe and sent off to a wastewater treatment plant, but that can be overwhelmed. And when it's overwhelmed, that water is spit out directly into local waterways, so a river or the ocean nearby. And that has a number of really nasty effects. It's, a health nightmare because it's just a whole bunch of human waste or, nitrates and whatnot that was picked up by the stormwater in your local waterway. It can affect fish, so you don't want people swimming in there. You don't want people eating the fish that are coming from there anytime soon. And it can cause harmful algal blooms that have a number of detrimental ecological effects in the area. And finally, just to discuss water resources moving forward, I said that the total amount of rainfall is not going to change very much. And I also mentioned that earlier, we expect to see evaporation increasing. So what's going on here? Well, even though the total amount of rainfall is not changing much, we expect to see an increase in our intense events, which means that we expect more of our rainfall to happen in these punctuated short-term events. And then in between that, because of heightened evaporation, we expect to see more dry to drought conditions. So potentially periods of flash flooding followed by periods of more water scarcity, impact for agricultural food resources and just drinking water for the population as well. That could be especially detrimental considering, say, we're along the Delaware that supplies water for New York, Philadelphia, and large swaths of New Jersey. And just to kind of wrap up thinking about future effects in terms of storms. We're slated to get slammed by the remnants of Hurricane Ian this weekend. We got hit really hard by Ida last year. That was a hurricane. So what can we think about those effects? Well, warmer water and warm, humid air is fuel for a hurricane. Basically, the more it's exposed to, generally, the more intense it becomes. So looking towards the future, we expect to see more energetic, so higher wind speed hurricanes. We expect them to intensify more rapidly. We actually saw that with Ida last year before it made landfall in Louisiana. You see that here. It encountered a pool of warm water and jumped up in category really quickly. So planning efforts for a smaller hurricane suddenly had to be stepped up to address a larger hurricane. And we expect them to virtually all bring a lot more rainfall. So practically here in New Jersey, we expect to see more flooding from our storms. We expect that if a hurricane makes landfall in New Jersey, we expect to see a lot more damage because on average, it'll be more intense. And if we think about Ida from last year, it's really a harbinger of what our future rainfall may look like within the state. Now, I'm not saying every year is going to be an Ida, but we expect to see more events trending towards that level of rainfall intensity, and really underscores how vulnerable the state infrastructure, the state lifelines, the state's population is to flooding, coastal flooding, flash flooding, riverine flooding. We're very vulnerable to all of it throughout the state. And with that, I'll leave off there and I can answer some questions about our climate trends here in New Jersey.
Thanks so much, James. So that's a lot. We're going to pause a bit and see what questions you've got. Again, this is informal. So Marjorie, first, I'm going to start by asking you and Paul to let us know if there's some questions in the chat. And
None in the chat.
None in the chat. Okay, great. So we can open it up now for our participants. How about any questions for James? That was a lot of information. Was that all like so crystal clear, James? You're a rock star.
Well, I hope it's clear.
So there is a question, were there any projections for our 100-year 24? Anne-Marie, do you want to unmute yourself and clarify exactly what you're asking? I'm not completely sure. I think it has to do with a rainfall event, but I'm not positive.
Sorry, I was typing quickly. So on the extreme precipitation slide where it had the 100-year 24-hour event, there were the projections for central and coastal New Jersey and for northern New Jersey, but I didn't see anything for southern New Jersey.
Yeah, that's broadly considered in coastal in some cases. But yes, there is coverage for that for basically every piece of New Jersey. The state DEP released a rainfall tool earlier this year where you can view that. And we're going to be also taking some of that information as well and fashioning some of our own extreme rainfall tools through the Climate Change Resource Center. But just to let you know, yeah, the entire state was covered with that.
So I think one thing I want to emphasize from what James has talked about and what we try to do in translating some of this complex science into tools that you can use is that for one is we work very closely with state agencies. So James has mentioned a couple times in his talk where the State Department of Environmental Protection developed or issued data with regard, for example, to precipitation. And so we then work with those data and with the state in terms of how we choose to interpret them on our data tools. So you can have comfort in knowing when you're accessing our data tools that we'll go through in a minute, that you're accessing data that is authoritative, meaning that it's coming from reliable sources such as state and federal agencies. So that's one thing that I think is important. The other thing that's important, and this is something that we'll ask you all to think about, is that as Lucas and Michelle walk you through our data tools, what hopefully you'll start to see is that we don't just slap data up right on a data portal. What we attempt to do here is to translate the data somewhat in terms of one of the things that we hear from end users like yourselves is that this is like a lot. This is too much. It's too complicated. It's too much to expect, any one local official to really have to be able to manage. And so the more that we can take the data, we at Rutgers, a trusted source of the State University, can take the data, analyze it, and put it in a form that's available to you. And my best example is something that James has been working on, which is creating a heat vulnerability index, right? So rather than expecting every public health officer in the state of New Jersey to access our data and understand heat vulnerability index, we're going to create one. We're in the process of creating one that you can use. So what we want you all to think about after you've seen some of these data tools is, what else do you need? Where else do you need us to assess and translate data so that it's helpful to you? Okay, so with that, any other questions on James's Climate 101? Okay. So,
I will
okay,
ask you,
go for it, Nicholas.
Sure. Thank you, Nicholas, Hillsborough Township. And just for some perspective, I live in Middlesex County, and the picture with the Raritan River there in New Brunswick. Last September, I had never seen the Raritan flood so much, and then this summer, I've never seen the Raritan dry out so much. So the contrast there was a spectacle to see. But what is the that 24-hour rainfall that I guess is a like, what's your ideal? Like, what do you want? Like, how much rain do you want? And then what's too much in the 24 hours in inches?
So that's extremely variable from location to location. So when you look at like a 24-hour rainfall event, we tend to focus in on like the extreme ones. And, you know, from a water management, public health perspective, you don't want any extreme amount of rainfall if you can help it. I'm trying to find, I'm not going to go through the entire process of looking up the data right now. Suffice to say, I start to raise my eyebrows a bit when you get more than 2 inches of rainfall in 24 hours. That's variable from location to location. There's certain parts of, for example, getting out of New Jersey, certain parts of the country where 2 inches in 24 hours, that's nothing. Other parts where that could be very damaging. But that's when that's when I personally start to kind of look at it with a little bit more of like a closer look.
Sure. Thank you.
I think Nicholas's question is a great question. And I think, I think we're going to talk about that as a group in our resource center a little bit, because it depends on what you're, you know, who it matters to. If you're an agriculture,
it might be very different for a farmer than a public health officer.
Seasonally. So that may actually be something for us to think about, trying to answer a question like that, or actually trying to interview a few people and see where we come out on that.
It's a very good question. It's also an incredibly complex, like a nuanced one that requires a better answer than I'm going to be able to give you at the moment.
But thank you for that, Nicholas.
Sure. Thank you.
Hi, this is Carla Kephart. I'm with Gloucester County Health Department. How are you?
Doing well. How are you?
Good. So I have a question for you. Last year in Gloucester County, we had a tornado come through our county pretty strongly. Mm-hmm. I'm assuming with climate change, that's also something we're going to see, which is not, I would assume, I'm not an expert, not something we would normally see in our region. And as a health department, it didn't affect us greatly, but it did affect us enough with loss of electric and septics backing up and city water backing up in some areas. Is that something that we can also see occurring more often?
So tornadoes are really finicky to model and capture. I will preface that. The New Jersey State climatologist released basically a tornado climatology earlier this year for the state. And I believe it's actually been showing a few more tornadoes on average in recent years compared to, or recent decades compared to like the long-term history. What I can say is part of this idea of increased storms in the future, coastal storms and the like, and their intensity, you could see an increase in thunderstorms and like the things that can make tornadoes. But as of right now, they're so finicky to try to piece together that my general thought is be prepared for them. But I can't tell you like an idea of, oh, we should expect to see an increase of like this many tornadoes per year or the like. The science, frankly, just isn't there yet.
Okay, fair enough. Thank you so much.
Thanks for your great question. Anyone else? So because we're among friends and we're saying this is casual, I want to suggest that if anybody needs a bio break, you can go take one and come on back. And if anyone feels that you want to eat your lunch while we're doing this, you're welcome to do that too. And that includes my colleagues on the Rutgers team. So now I'm going to turn it over to Lucas Markson and to Michelle Stewart, who are going to walk you through the various data tools. And when I say data tools, that means guidance. Lucas is a little bit of a fast talker, and when we've done these trainings before, we've had a number of people ask him to slow down, and so I've asked my Rutgers friends to also shout, Lucas, slow down. So we will take pauses during Lucas and Michelle's presentation, but at any point, if you need something emphasized or something's not clear, come off mute, let us know. Or put something in the chat and we'll keep an eye on the chat. So Lucas, Michelle, I'm turning it over to you.
Thanks,
But Luke, I will tell you, you were at very good pace yesterday.
Thank you. Apparently I missed my calling as an auctioneer, so life's unlived. Okay, I'm going to share my screen and just minimize this. Okay, good afternoon, everyone. So I'm going to spend some time today showing you guys some of the different toolkits that we've developed as part of our NJADAPT platform. That you may find useful in the context of public health here in New Jersey. So all of our tools, as they become publicly available, are available from the Climate Change Resource Center website, which Marjorie provided the link earlier in the presentation for. You'll see here right now the three that are currently public are our NJ Flood Mapper, our Municipal Snapshots, and our NJ Forest Adapt. I'm going to be showing you two additional tools that are expected to come online in the coming weeks. One that's actually quite early, like kind of in beta, which you guys will be the first ones to see, and we're actually looking forward to getting some feedback from you as public health officials about what you like about it, what you'd find more useful in terms of things that we may be able to add to it as well. So I'm going to kind of jump through each of these. I'll take small breaks after each one to answer any questions you may have about the individual tools or any of the data behind them, and then we'll kind of take it from there. So I'm actually going to start with our new one. This is what we're calling our NJ Public Health Adapt snapshots. So these are going to be kind of canned reports to provide you with data about various different population and household and health statistics for specific areas in New Jersey to kind of help you understand, what the potential health impacts could be in these areas due to climate change. So the way the tool works, it's you have some simple drop downs here where you can select either an entire county for an analysis or you can select a municipality. So, since we're at Rutgers here in New Brunswick, I'm actually going to select New Brunswick City. And then you just click down here for our available reports. As this program progresses, we may add additional reports on you for different types of climate hazards so that we can show specific impacts across these reports over time. But for now, the majority of the data we're showing here is going to be demographic data from the U.S. Census's American Community Survey, as well as data from the EPH public health tracking tool from the CDC. So I'm going to open this report here. So when you open the report up, you'll see at the top here, it provides you with the location you've selected. We also have the ability to basically generate the report as a PDF file, so you can download that and have it for your own records. And then as we finalize the report, we'll include a data download here, so you can actually grab all the data in Excel format. So in case you want to do any manipulation with the data or any kind of analysis of the data internally, you can do that as well. So the report starts with a kind of a general, demographic data. We provide the total population estimate for the area you've chosen of interest, and then we have some various variables that we feel might be useful in terms of a public health context. So understanding the number of people under the age of 5, the age 65 and older, those who are 65 and older and who are living alone, everyone living alone, regardless of age, people from the age of 18 to 64 with at least one disability, people over the age of 16 that are unemployed, the percent and number of foreign-born individuals within that locality, the number of people living below the poverty line, people who indicate that they speak English less than well, people with less than a high school education, and people who identified as having ambulatory difficulty or cognitive difficulties, people who primarily do outdoor work, people with no health insurance, and population in group quarters. And you'll see for each of these, we provide the population estimate for that location. So in this case, for New Brunswick, New Jersey. And then we also provide the percent of the total population that amount represents. The next section that we provide is variables on demographics on race. So we provide the number of people that identify as Hispanic and Latino, Those identify as Black or African American, American Indian, Alaska Native, Asian, Native Hawaiian, another Pacific Islander, or another race, and as well as white Caucasian, and the population estimates for those and the percentages for those as well. Moving on to household census variables. So we provide the total housing units and the total occupied housing units within the area, so you can have those as reference, and the total households with people under the age of 18 as an estimate. So we provide some information here about homes that were built before 1980 and 1960, which may have particular impacts with regard to climate change. The number of homes that are considered overcrowding. So this is a census measure that looks at the number of people in a household versus the number of rooms within that structure. And so this is for households that have more people than rooms available. The number of households with no internet access, so it may be difficult for them to obtain information regarding potential climate change or health impacts. The number of households that are single parent, the number of renter occupied units, as well as the number of households with no vehicle access. Moving on to some of the health specific variables. So these, like I said, these come from the CDC. The latest year we have the state available for is 2018, except for the high blood pressure, which comes from an earlier 2017 year. So we have population estimates and the percentages for things such as the number of people reported to have asthma, with COPD, with coronary health issues, that report regularly binge drinking. Those were reported to have be obese, those that are smokers, those with diabetes, as well as those with high blood pressure. The next thing we provided, we're working on is providing a few different maps to kind of show, spatially within a town where, certain areas of concern may be. So one of the things that we've developed, which I'll actually let James talk about briefly, is our heat vulnerability analysis. This is basically a way to model areas that are at high risk for heat issues regarding climate change based on various factors. James, do you want to jump in quickly and give a quick, just brief overview of what this was about?
Sorry, I lost my unmute button. Yes. So vulnerability to extreme heat has a lot of different geography to it. You basically have a number of components based on exposure to certain conditions. So I mentioned before, we have that urban heat island effect. So people living within cities or areas with more impervious cover are more vulnerable. You have certain socioeconomic issues. For example, folks who live below the poverty line may have reduced access to AC, or they may have less of a capacity to recover from an extreme heat event. And then you have other, health effects like rates of asthma and the like asthma issues are exacerbated when you have a high heat event, primarily due to this air pollution thing that I covered earlier. So we take a number of different aspects by census tract geography and turn them into a composite index that's ranked throughout the state. So we have in this image here from 1 to 5, indicating relative vulnerability based on population characteristics to extreme heat. So 1 is low vulnerability, 5 is high vulnerability, so blue to red. And each one of those bins is like a 20th percentile bin for the state. So it's a relative ranking, not within your community, but relative to the entire state, as to where that census tract falls in terms of its relative vulnerability. And moving forward, we're hoping that to include functionality where you could click on one of those and see not only where you rank within the state, but what of those characteristics that contribute to that vulnerability you score high in. Maybe you have a high number of people in your community that have asthma prevalence or a high rate of poverty. And so you can start to think of like kind of tailored solutions based on your community. Mm-hmm.
Great, thanks, James. So yeah, as James said, we are adding that in. We do have the ability to click on the maps, but right now it's just showing the vulnerability index scale value. Some other data we're looking to try and provide in terms of spatially to show risk is things such as like cancer risk from air toxics. So this map here is showing that excluding diesel particulate matter, and it's basically showing color coding in terms of the cancer risk per million population. We also had this for non-cancer risk from air toxics. This is actually based on a health index, where 1 being low and 6 greater than 6 being the highest. And then we also have a map here showing diesel particulate matter cancer risk. So again, cancer risk per million population. We're also looking at a few more maps to show some other potential, either both air pollution or proximity to things such as like high volume traffic areas, roads, things like that, where you can have issues with air pollution as well. So like I said, this is a work in progress, this report, but it's something that we are working on. We wanted to share with you as a group to kind of, gather some feedback and get your kind of opinions on. So I'll stop right here for a few minutes to take any questions about this tool specifically. If there are any comments from the group too, we'd be happy to hear them.
Thanks, Lucas. So folks are pausing for questions. So again, you can put something in the chat or come off mute and let us know if you've got questions.
This is Michael Hodges. I think it's an excellent tool, especially because a lot of health departments are doing community health improvement plans and community health assessments. So it's one more, it's another useful piece of data that's kind of unique for these assessments that will allow them to capture, the health impacts of the climate on those in the municipalities that they serve. So I think it's a really nice instrument. Thank you.
Michael, thank you so much. That is music to our ears. Specifically looking at those kinds of improvement plans that all of you lead, as well as hospital community health needs assessments, is specifically areas that we hope that these tools and data can be helpful for. Other questions or comments? So this is not yet public. You all are getting the sneak peek. And we'll come back and talk about this tool a little bit more, because it means that you have the opportunity to help influence what goes in it. Okay, Lucas.
All right. So moving on to the next tool, this is one that is publicly accessible. This is our climate snapshots tool that's available from the NJADAPT program page. This has this kind of a similar layout to the public health adapt that I showed you just now. Again, these are all municipality based currently. We are working on an update in the next few weeks that will actually allow you to run these at a county level as well as a statewide level. But to begin with, these are primarily looking at climate change impacts on areas. And so they are primarily focused on flood impacts in many cases. However, there are some that look at some things such as heat as well as rural populations. So for our example today, I'm going to choose Atlantic City since it can show us a little more in terms of what the flood type information is involved in. Once you pick your location, you'll see there's 5 different reports. We have a built infrastructure report, a critical assets report, a natural working lands report, a public health report, and a vulnerable populations report. So just to kind of briefly show what some of these include. So for built infrastructure and critical assets, these basically give you a similar type of report that you can download as a PDF. It gives you an introduction that kind of explains the data that's being used in this report in terms of flooding. It shows your area in the little map here as well. And then it goes into showing things such as what we've classified as critical assets in this area. So things such as schools, fire stations, hospitals, nursing homes and assisted care facilities, child care facilities, and evacuation shelters. And for your locality you've selected, it shows you the total number of assets that exist within that municipality and the number that are exposed at 2 feet and 7 feet of total water level. A total water level is a concept that was developed between the DEP and us to look at the impacts of both sea level rise and future flood events. But in terms of, for your purposes, you can actually consider a 2 foot or 7 foot total water level similar to that amount of sea level rise occurring. We also have some graphics to show this information here visually. All these graphs, you'll see there's a little menu button up here. You can actually click on those and you can download the graphs as image files or the data behind them as like Excel files if you want to make your own visualizations. But this is nice in case you want to use these into any type of report or presentation. In addition to the total water level impacts, we also include impacts, the number of assets that occur within the different FEMA flood zones. So you can see which of those assets exist within the 1% annual chance flood zone, which is the 100-year storm flood event, or the 0.2% annual chance flood, which is the 500-year flood event, and see which ones of those facilities may be impacted there. And again, we provided a visualization of that in graphical format. And then below that, we provide maps showing some of those locations and within the FEMA flood zones and within those 2 different scenarios for total water level or sea level rise. Each of these also have a link which take you to directly to NJ Flood Mapper, our other mapping tool, which basically loads all this data automatically for you within the tool. So you don't have to worry about kind of trying to do it yourself. And I'll show that actually a little later. And then below here, we have the legend, which basically indicates what all the different iconography on the map represents. And a little appendix giving some background information regarding the total water level approach. It's a little small here, but you can see this little infographic basically shows what we mean by total water level, looking at the current highest high tide, the amount of sea level rise that's predicted to occur on top of that, and then say some type of flood or storm event that may occur on top of that sometime in the future. And then we also provide data sources for all the data sets used in here.
Hey, Lucas, I just want to pause a minute and because this whole concept of total water levels might not be intuitive to people, so I'm going to probably botch my explanation of it, and people like Lucas and James can correct me. But the concept of total water levels, for those of you who reside in 239 municipalities that are in New Jersey's coastal zone, is that flooding levels are influenced by lots of factors, certainly when there's an extreme weather event, but by also just increases in the base sea level. And one of the things that we've heard for years from end users is that it's too confusing to expect an end user to assess what are current flooding conditions, what do we expect in terms of storm surge, what do we expect in terms of sea level rise. So this concept of total water levels is an example of where Rutgers, rather than just slap the data up and expect all of you to figure out how to use it, created this tool of total water levels that you can use because it now allows you to essentially combine those different elements of flooding, including future flooding as a result of sea level rise. So this is a really good example of where we are trying to translate the science into tools that you can use so that you don't have to go figure out what are projected levels of sea level rise on your own.
Yeah.
So I hope that makes sense.
Yes, perfect. Thank you, Jean. And so I'll actually show the total water level tool briefly when I discuss NJ Flood Mapper in a little bit.
Okay.
So the build infrastructure report, same as a critical asset report, except it includes things specifically looking at, say, like wastewater facilities, energy generation and power plants, gas stations and bridges. I'm not going to spend a lot of time on this one. Natural working land specifically is looking at the impacts on the natural environment. So this is looking at things such as impacts on wetlands, on different types of land uses, such as open space and agricultural lands, and looks at their impacts within those different types of flood scenarios. We also have some data on marsh erosion and wetlands retreat, but again, these aren't really specific to really a public health impact necessarily. The two that I want to spend more time on are our public health report and our vulnerable populations report. So our public health report, again, we have a little introduction here explaining, the climate impacts on public health and what those can include. And then we have some data here looking at projected climate data. This is similar to what James was showing previously in his presentation. And specifically, we focused on some data on, so the number of days above 95 degrees Fahrenheit, the maximum temperature expected in July, and a measure called cooling degree days. So this may not be familiar to a lot of people. This is actually a measure to look at the amount of energy that's required to cool a household or a building structure to 65 degrees Fahrenheit based on the external temperature. So obviously, the hotter it is outside, the more energy is required to cool a building to a more comfortable level. Just to kind of explain this chart, in the first column here, we provide our baseline. So this is kind of our historical data from 1981 to 2010 to show what the number of days above 95 degrees Fahrenheit for this location, Atlantic City, is roughly less than or equal to 4 days. And we have a max temperature roughly in between 81 and 85 degrees. We then provide data for two different emission scenarios. So similar to what James was talking about, we have a moderate emission scenario, which is basically that which tracks with current global policies, and a high emission scenario, which would show an unfettered kind of increase in greenhouse gas emissions. And then for each of these, we provide 3 timeframes. So for 2030, 2060, and 2090. And so you can look at, say, a moderate emission scenario out to 2060 and see that we based on the current global climate models, it's predicted that the days above 95 degrees Fahrenheit could increase anywhere from 0 to 10 days above the 4 that we've seen historically. Similarly, we can expect the max temperature in July to increase anywhere from 3 to 4 degrees from the 81 to 85 degrees that we currently have seen historically. Looking at a high emission scenario, you can see these can jump up significantly. So out to 2090, upwards of 11 to 20 additional days above 95 degrees Fahrenheit, and a max temperature anywhere between 6 and 10 degrees higher on average for the month of July. So this can be useful information to kind of understand the future potential heat impacts on localities, and understand what planning efforts might be necessary in terms of things such as cooling centers and things like that that might be necessary to help deal with these types of issues. We also then provide some information on health-related sites that are in flood-exposed areas. So looking specifically at hospitals, nursing care homes, and assisted care facilities, and then also things that can have environmental health impacts. So known contaminated sites and EPA Superfund sites, and how many of those exist within the municipality, and that would be exposed at both a 100-year flood event and a 500-year flood event, or that 2 feet of total water level or 7 feet of total water level. We also provide a link directly from this report to our vulnerable populations report, which I'll show next. And then we have a live map here that shows basically the FEMA flood zones and the 2 feet and 7 feet of total water level, looking at all the facilities we previously talked about, so hospitals, nursing care facilities, and known contaminated sites. The final report, our vulnerable populations report, this report's a little different than the rest in that it's basically focused on demographic data about the vulnerable populations that can exist within that municipality. And so we provide some basic general statistics about the municipality to begin with. So the total population, the total housing units, the average municipal household income, the total acres within the municipality, and the total urban area within the municipality. In order to try and provide better estimates in terms of the amount of population exposed at different amounts of flood levels, what we did was we actually looked at the amount of urban area that was impacted by those different flooding events and used that proportion of that area to then apply to the demographic data within that location to try and get a better estimate of who might actually be exposed, since we typically find that the populations are concentrated in those urban areas in terms of land use, land cover across the state. And so the data we provide is based on the CDC Social Vulnerability Index. We break it out into the 4 main categories that they use for their index and show the individual census variables that go into creating that index variable. So we start with socioeconomic status. We have data on the amount of population below poverty, the unemployed, and no high school diploma. The first column here we provide is the population within Atlantic City in this case, that for each of those categories. We then show the percent of the total population that represents. And then we provide the population estimates that could be exposed at the 2 feet of total water level and the 7 feet of total water level. And then we repeat that and show the impacts for the 100-year flood event and the 500-year flood event. We also provide links to the maps here. So I'll click on this right now. You'll see it actually automatically opens up NJ Flood Mapper, which is our visualization mapping tool. It automatically zooms in on the city that we are interested in, and then automatically loads the data here on the right-hand side. So you can add things to look at, say, that CDC SVI index for socioeconomic vulnerability, showing the darkest green being the highest vulnerable, the top 25% across the state. And you can even look at the individual things such as like the population below poverty, things of that nature as well. So this allows you to kind of pinpoint where those are located geographically within the areas you may be interested in. The next category we have is household composition and disability. So we have variables such as the age 65 and over, 17 or younger, and civilians with a disability. Again, showing the flood impacts both for the total water level and the FEMA flood zones. Also some household data on single parent households and showing those vulnerabilities to the different flood events. The next section we have is minority status and language. So breaking out the population statistics based on those reported as being a minority, and then breaking them out by the individual race categories, as well as those identifying as Hispanic or Latino. And then people who reported that they speak English less than well, and how many of those would be exposed to the different flood levels. Final category is housing and transportation. And so this provides information on multi-unit structures, mobile homes, crowding, which, as I said earlier, is that more people than there are rooms within a household, households with no vehicle, and populations within group quarters. And again, this is a nice way to kind of understand what the potential exposure for each of these different types of vulnerable populations might be to different flood events within your locality. So just to also specify too, while we picked Atlantic City to both see the total water level and the FEMA flood zone impacts, you can run this tool for any municipality in New Jersey. Inland municipalities still have data on the FEMA flood zones because these are a statewide flooding layer that looks at both riverine and coastal flooding. So you can still get estimates in terms of populations being exposed due to within the FEMA flood zones throughout the state. And then at the bottom here, we provide some links to additional vulnerable population data that we have in our NJ Flood Mapper tools. So we have data from like the DCA's Municipal Revitalization Index that looks at specifically distressed communities, data from the United Way on their asset limited income constrained employed population. So this is specifically looking at like the working poor across the state at a municipal level. We also have some data from the NJ Counts, which is looking at the homeless population across the state, kind of a county level. And then we also have data on veteran populations, housing stock that's built prior to 1970, maybe specifically vulnerable to flooding instances. And then we also have data from Oak Ridge National Laboratory, what they call their land scan, which actually shows the actual density of people across the state. So that kind of covers our climate snapshots, our municipal snapshot tool. Again, I'll pause here and happy to take any questions you may have about this tool specifically or any of the underlying data.
Thanks, Lucas. And just to emphasize, this is a tool that's already public. It's on our website. Marjorie had put the link to the Climate Change Resource Center in the chat at the start of the meeting. So you can access this now. To be honest, I use these municipal snapshots probably every day. They're super easy to use. You can just put your municipality in and get all this rich data. So let's open it up for questions, again, either in the chat or you can unmute and ask any questions.
And Jean, I'll put the direct link to NJADAPT in the chat.
Thanks. Thanks, Marge. Questions, thoughts, comments?
I actually have a comment.
Thank you.
Word on this county health officer.
Hi.
Have you shared any of this data with can you hear me?
Mm-hmm. Yep.
Yeah,
We can
okay.
hear you.
Yeah, this is just because we're all kind of dealing with this new lead law. This would be such a helpful tool to municipalities, especially for the housing stock. Just because
That's actually a great idea.
70.
Yeah.
Thank you, Maya.
Maya, thanks so much.
Yeah, I'm actually. Yeah.
Go ahead. I'm sorry.
No. I just because my staff is gonna reach out to you guys.
Great.
Because it is like perfect for us. Okay, wonderful.
That is great. We are thrilled. We're here to help. And we actually have been invited to present a lot of these tools in the coming weeks to the governor's office, as well as to Commissioner Persicelli at the State Department of Health. So we'll make a note about the lead work.
All right, perfect. Thank you so much. Bye-bye.
Thanks. Other questions or thoughts? We're putting a lot on you here, you know. So we will make sure you know where to find us in the future.
We also would love to hear how you see yourselves using it in other ways. I mean, we're very, very interested in that. I mean, we've thought about that ourselves, but we want to hear, and we've talked to people in the health community who've helped us design it, but now that we're rolling it out to more people, we're always interested. Thank you.
Yeah, and we're going to pick your brains in a little bit too. Okay, Lucas.
All right, moving on. So this is a new tool, NJADAPT. This is scheduled to be released within the next few weeks. This is basically our hazard mitigation planning tool. This was developed in partnership with the New Jersey State Office of Emergency Management. It was really meant to help counties and municipalities understand the different hazards and that their localities may face in terms of understanding the impacts for their hazard mitigation planning efforts. So similar to the tools I've shown previously, you can select your location that you want to get data for. You can either get data statewide, you can get it at an entire county level, or you can drill down further and get it at a specific municipality level. So just to kind of give you an overview of the kind of data that's available through this tool, the first section of data we have is a flood hazard analysis. This specifically is looking at the impacts of flooding on what are identified as lifeline sectors by the U.S. Department of Homeland Security. And so these are all, kind of categorized data sets showing all the different facility locations within each of these categories. And we've provided a pre-analysis of all of them to show which of these facilities are impacted at both 2, 3, 5, and 7 feet of total water level, as well as the 100-year and 500-year flood zone, so that you can easily see which of these facilities would be impacted by different types of flood events within your locality without having to do that work yourself. And so you can see some of the categories here. We have everything from communications, energy, financial, food, water, and shelter, hazardous materials, health, safety and security, and transportation. So from here, using any of these, you can download the actual Excel spreadsheet data showing each individual location, all of its accompanying attribute information such as address and contact information, and then the flood analysis data for each of those locations as well. We also provide metadata that shows the information for each of these categories, where it comes from, so you can understand those data sets better as well. We also provide some links to maps. So again, this will take you automatically to NJ Flood Mapper and preload all that data for the area that you're interested in. So we picked Middlesex County, and you can see here it's already loaded data on veteran health medical admin facilities, urgent care facilities, public health departments, pharmacies, nursing homes, hospitals, emergency medical services, dialysis centers, and then the county boundary here. And so these are all interactive as well. So you can click on a specific location. And so we can see this is Sayreville Pharmacy Incorporated in Sayreville, New Jersey. So you can get to that information as well. And then from here, we'll show an NJ Flood Mapper later how you can quickly add flooding data onto this map to see how these individual locations could be impacted. The next set of data that we provide is on heat hazard. And so this can be definitely very useful in the public health context. We have 2 different data sets here that you may find useful. The first is a heat wave analysis. This is done at a county level. And when you download this, it basically opens up a zip file with an Excel spreadsheet as well as a PDF file for the metadata. And if we open up this Excel spreadsheet, just so I can show you this data, let me just make this full size and zoom in a little. This is basically providing data on heat waves, both historically as well as projected out into the future based on the different climate scenarios. So you can see here, we have our county, and then our data set here shows the row for historical data. And then we have it for that modern emission scenario, the 4.5, which is based on the current global policies, and the 8.5, which is the increasing amount of greenhouse gas emissions. And we have it for 2 different time periods, 2036 to 2065 for kind of an early century time period, and 2070 to 29 for kind of a late century time period. And so for each of the counties, we've looked at the historical data to get the threshold value that basically indicates when a heat wave has occurred historically. We provide the annual average number of heat waves, both so for the historical period, we can see in Middlesex County on average there's 1.1 heat waves per year. But based on these future scenarios, we can see how that's expected to increase under those different scenarios. So under the highest emission scenario for the late century, we expect that to potentially increase to an average of about 7.7 heat waves per year. For the projected data going forward, we also provide for that a range for that average value. So you can see the 10% and 90% in terms of the kind of the high and low cutoffs for the most expected values that would occur. So we do expect it with an average 7.7, but to basically fall within most likely between 5.4 and 12.7 days. I'm sorry, not a number, not days. The next section we have is the actual heat wave duration in terms of days. So again, for the historical period, we on average we'd see 3.2 days, and for those higher areas, we can see how much longer we expect heat waves to occur. And again, we provide that 10%, 9% kind of cutoffs for the high and low value as well. And then finally, we provide data on the annual maximum heat wave duration. So when we're looking at the longest heat waves that we would see historically, this roughly has been about 7.6 days. But then, you can see how much these greatly increase based on our different emission scenarios going forward into the future as climate change occurs. And again, we then provide the 10 and 90% bounds for those as well. So it's going to close that up quickly. Oops. The second data set we provide as part of the heat hazard analysis is a heat island analysis combined with overburden community analysis. So the link here will provide you actual spreadsheet data for all the different census block groups within your specific location. But the easiest way to kind of understand this is actually to open up the map version of this. So it's going to bring it up for Middlesex County. I'm going to open up the legend over here. So just to kind of give you an overview of what's going on here. So everything where you see the cross hatches across this part of the state are what the DEP's environmental justice laws as designated as overburdened communities. And then the color coding underneath basically is providing information that we've done on analysis to look at the proportion of canopy cover, so the amount of trees within an area, to the impervious cover, the amount of paved surfaces. And so the darker the green is basically areas that have a much higher proportion of tree cover than impervious cover. So these are areas we don't expect to really suffer from potential heat island impacts. Whereas the darker brown color is going towards a -1 index, are areas where we have a much higher proportion of impervious cover than canopy cover. And so these are the areas that we would expect there could be potential heat island effects from, and where you might need to start thinking about, the impacts of heat in those areas. And so you can click on these areas and get information on the specific location and get various information on the population and the overburdened community. So in this case, this is considered overburdened because of a large minority population here. And so this can be a useful planning tool for understanding the areas within your either town or municipality or county that may be specifically adversely impacted to heat impacts in future. The next section we have is our social vulnerability data. So this is basically the same exact data that was in that vulnerable population snapshot previously, but allows you to download all the data to do your own analysis with. And it provides it at that custom geography that you've selected. So you can run this at the town, the municipality level, the county level, or statewide. And it'll provide you with all the population estimates in addition to the population estimates that would be impacted by those various flood level events that we discussed. And again, we have links to the maps for those as well. And then finally, what we have is what we call our Mod 4 parcel flood analysis. This is basically looking at every single tax parcel property across the state and providing a flooding analysis for those parcels for that geography. The interesting thing and useful thing about this is it includes all the tax assessment data as well. So you can actually look at properties based on, say, their property class. You can look specifically at flooding impacts on, say, state-owned properties or certain properties such as commercial or residential or those designated as hospitals, and understand for those specific properties at what point do they become flooded from anywhere from 1 to 20 feet of total water level, as well as within the FEMA flood zone areas. So this can be useful for understanding specific property impacts within the geography you may be interested in. So that is our NJADAPT. Again, I will pause here briefly for any questions or comments about this tool.
And what I'll add here is that the way that these tools are designed is we identify certain end users. So in this case, for HazAdapt, it's specifically designed to try to serve up data that local, meaning county and municipal hazard planners need to have in order to develop hazard mitigation plans and other functions. The public health snapshot that Lucas showed a little while ago that's not quite yet public is intended to serve up and automate data for local public health officials. And then, the municipal snapshots are from municipalities. So we keep building these applications. So we wanted to share this HazAdapt, the hazard mitigation planning tool, with all of you because we think there's some data in there that might be particularly helpful from a health perspective. Okay, so let's open it up for questions. Any questions in the chat? Or you can come off mute and ask questions.
There aren't any questions in the chat, by the way, Jane, if you were waiting for me to answer.
No, it's all good. It's all good. Okay, Lucas, and now you're going to bring us home, right?
Yeah, so I'm just going to really quickly show some of our other tools just so you're aware of what exists and how you might be able to use them as well. I'm not going to go into really a deep dive onto these because there's a lot of additional data in these that could be confusing at times. So I don't want to overburden you. We've already given you a lot of information so far. So NJ Flood Mapper is our kind of go-to platform for visualizing flood impacts across the state of New Jersey, both current day and future flood impacts. Just to kind of give you a little overview, all the functionality for the map is here on the left-hand side in terms of the data sets you can add. We do have the ability to kind of manipulate data as you put it in, where you can change kind of what layers appear on top of each other. But the main things I want to point out here is, we've mentioned total water levels a lot here. We do have, this is where we have our total water levels tool. And there's a little button up here, which actually brings you to a walkthrough tool that basically provides you kind of a background information on what total water levels is, and then kind of walks you through step by step with selecting a location that's of interest to you, selecting an emission scenario that you're planning for, even selecting a planning horizon. So what year are you looking out for in terms of flood potential impacts? And then it gives you things such as this, based on your selections, a sea level rise estimate. So how much sea level rise could potentially occur based on your location, your emission scenario, and your time frame. And then, based on whatever your planning horizon is, you can, or what you're planning for, you can select the appropriate sea level rise estimate that you think is, for your analysis. And then you can pick those additional flooding events that would occur on top of that sea level rise. So you can look at just permanent inundation. You can look at anything from a 10-year to 100-year flood event. You can even add in historical flood events. We've pulled in data from historical floods so to understand, for people who may not be able to think what a 100-year flood really looks like, but what Hurricane Sandy looked like within your locality. And so you could pick Hurricane Sandy and get a flood estimate. And basically, it gives you kind of the total water level results based on all your tools. And you can easily add that to a map and actually visually see what the flood inundation would be based on that scenario. We also have additional flood hazards here you can look at. So you can look specifically at sea level rise, hurricane, coastal inundation models for category 1 through 4 hurricanes, those from the flood zones that we've talked about that are statewide. And then you can basically look at other data to look at how this can impact your locality. So you can look at specifically facilities and add, say, hospitals to your map and see where those hospitals are located regarding, specific flood events and see which hospital those are. We have a lot of that social vulnerability data that we talked about in the municipal snapshot that you can add, environmental hazards, things like that. So it basically allows you to visually see the impacts of flooding on all these types of resources and demographics across the state. You can reach the municipal snapshots directly from the NJ Flood Mapper, and there's even the ability to kind of save, share, and print these maps. So if you kind of create a map that you think is interesting for your area, there's ways to export that map as an image file that you can easily put into a presentation or report. So that's kind of a real brief overview of Flood Mapper. Like I said, if any of you have any questions about these tools, definitely feel free to reach out to us. We're happy to kind of give you more of a walkthrough through them or answer any questions you may have. The only other one I'll mention we do have is NJ Forest Adapt. This is very specifically designed, as Eugene said, we do make these for different types of use groups and stakeholder groups. This one's really designed primarily at forest managers throughout the state, understanding the impacts of climate change on forestry. However, this is one of our tools that has regional data on climate. So if you want to visually see the number of days above 95 degrees Fahrenheit, looking at a high emission scenario and then picking 2050 to 2070, this will allow you to visualize, where that heat is expected to occur, across the state and the region as a whole. And so, as we build out more tools, this is, something that we'll be incorporating to them as well. But for now, accessing data on, say, heat and precipitation is accessible through that Forest Adapt tool. And so I'm going to stop there. Hopefully I'm still on time. Are there any final questions or comments before we move on to the next?
Yeah, you're great, Lucas. Thank you so much. So yeah, we're going to take a pause here before we open it up for discussion.
I'll ask a question.
Sure. Yeah, go for it.
Lucas, you were talking about the like heat index predictors and talking about ratios with impervious versus non-impervious lands and the reliance on canopies. And I don't know how far your predictors go, but do you account for these tree blights that are coming across New Jersey? Like our ash trees are going by the million, and I suspect others will follow.
So yes and no. So the data that we use to calculate those areas comes from it's a national land cover database that's generated every few years. And so it basically uses satellite imagery to kind of estimate the amount of canopy cover or the percentage of canopy cover within these little kind of pixel areas across the state. And so the latest I believe we have data for is, I want to say 2019, but basically as trees are impacted by those types of blights and die off, we expect that as those data sets are updated, we will see that change in those data sets. So it's not a super specific in terms of being able to see individual trees, but we would expect the percentage of canopy cover within those locations to decrease.
But that is a great point, Nicholas. Yeah. You're unbelievable. Really helpful, because I think maybe, Lucas, we should think about how we couch it, and it's almost like an uncertainty factor, right? That we can't quantify it, but maybe there's a way we could separately think about rate of loss for certain species, and just to let people know that that's something we're not able to account for right now.
Yeah, our Forest Adapt tool, we do have some data on there, though it's not updated super frequently on losses due to different types of pests. So we have data such as like on emerald ash borer and the amount of tree loss that's occurred from that pest. So maybe looking at some of that data in conjunction with the canopy cover data to understand what the areas that may be particularly at risk from pest and disease.
But also for end users to understand that we also have on Forest Adapt, I'm pretty sure you showed Lucas the species that will thrive better into the future.
Yeah, I didn't get into that with this group today, but yes, we do have data on there that looks at specific species that are prevalent across the state, and you can see how they're kind of distributed roughly spatially across the state and the region, and then look at different climate scenarios to see how those are expected to change. So, as temperatures rise, we expect certain tree species are not going to be suitable in areas in, New Jersey and may be more suitable further north from us. Likewise, we expect species that we don't really normally find in New Jersey may be more suitable in New Jersey in the future due to the higher temperatures. So we do have tools looking at some of those species to look at how those distributions may change to help kind of understand maybe what trees you should be planting now that'll be suitable in the future.
Sure, thank you.
Thank you. Other questions on these last tools that Lucas showed? Okay, so now we have a couple questions for all of you. And this is not to give you a quiz, but rather to try to understand the nature of the work that you all are doing that could benefit from use of these tools and guidance. So what we'd like to hear from you all on is what kind of work are you engaged in that may benefit from use of these tools. So for example, we would be interested to understand the extent to which public health professionals are involved in local efforts to prepare climate resilience plans or climate adaptation plans. There's a couple of programs here in New Jersey that are working with municipalities to develop these kinds of climate preparedness plans. And we're part of our question is what's the extent to which those efforts are involving the public health community. Similarly, we want to understand the extent to which the work that you all are involved in with regard to community health improvement plans and hospitals' community health needs assessments. What's the extent to which those planning efforts are thinking about climate futures or environmental health in general? So that's a second area that we think these tools have value in. A third area is every county and every municipality here in New Jersey needs to develop a hazard mitigation plan. Each municipality develops what's called an annex, and that becomes part of the county hazard mitigation plan. And unless the county has, if the county does not have a plan in place, an intact, up-to-date plan in place, then it means that the county may, and municipalities within the county may not be eligible for disaster relief funds from FEMA. And so part of our question is, what's the extent to which the public health community is involved in developing those hazard mitigation plans? And then I think finally, another area that we think these tools could be helpful in is the extent to which you are involved in applying for state and federal funds or other funds, but generally state and federal funds, and the extent to which having these kinds of tools and data at your fingertip could be helpful for you in terms of whatever demonstrations you need to make as part of those applications for funding. So those are community resilience plans, community climate resilience plans, community health improvement plans and hospital community health needs assessments, hazard mitigation plans at the county and municipal level, and applications for funding. So those seem to be the areas that we think these tools may be helpful in the short run, like in terms of the work that you all doing today. But we'd love to hear from you as to the extent to which you think these tools will benefit you, but also the extent to which you're even involved in those procedures and processes. So I'm going to open it up for conversation. Any thoughts, reactions?
Don't be shy.
We have a hand up. Yes.
Hey, Jean.
Go ahead, I'm sorry.
I'm on camera now.
Okay, great. Nice to see your face.
Nice to see you too. I think there's quite a bit of money actually coming down the pipe for local health departments, grant funds, and much of it has to do with health equity. And germane to health equity is addressing social determinants of health. And this is all part of that. Climate and the conditions that climate change affects health, both immediately and down the line. So I think in the very near future, health departments will be looking quite extensively for information of this sort, especially because they're still reeling. And I say I just stopped being a health officer about 7 or 8 months ago. But they're still reeling and recovering from COVID-19. And the thought of taking on something new is probably kind of a big thought, but the fact that the funding is there makes it a lot easier to take on something new. So because health equity and social determinants of health are baked into this funding, I think they will be looking for the data that you're providing quite a bit.
Thanks.
So can I ask? Oh,
I was just going to say, I think one of the things we're also hoping in terms of how we design these is that it's almost like you can come on the municipal snapshots and you can come on the Health Adapt, put in your community and press print and attach it to your grant application. That's the goal. Marjorie, I'm sorry.
No, that's fine. So Mike, it's really nice to see you in person, as opposed to voice on the phone. So can you just give us a sense of where you think these funding pots are coming through?
They're coming through the CDC.
So they're all CDC pots.
The ones that I know of, yes.
And are they generally flowing through the State Department of Health, or is the eligibility through for local health agencies to apply directly, or both?
The State Department of Health is a pass-through.
Yeah. Okay.
But then it will ultimately be for the local health departments, though.
Okay.
And that's all about health equity.
It's not all about health equity, but just about every allowable
It's a
program
component.
has to have a component. Yeah.
Got it.
You know, it's interesting, and of course I can't get through this training without giving a shout out to Candace Davenport, because Candace was participating in a working group for a project I'm wrapping up literally today, on that, among other things, includes components for municipalities on how to think about the connection between health equity and environmental justice and climate. And so, you know, I think one of the things that Candace has challenged me to think about is there's an awful lot of work here in New Jersey and a commitment to environmental justice. The public health community really hasn't yet been brought into that in terms of how they are change agents associated with advancing environmental justice. And so I think that gives me some thought in terms of some ways to maybe frame some of these data tools as well.
That's great. I don't know if anybody else wants to speak to this before I move to the notice we got from Karen Polillo.
But one other thing this makes me think is, I mean, again, this is our chance to listen to all of you, is that maybe something else that would be helpful to all of you would be to have some handy dandy language that you all can use if you're applying for funds in terms of the how climate conditions exacerbate health inequities, right? So that, again, as much as we try to automate these data so you can access them, print and push, but if we can provide some language that you can cut and paste from, then that seems like a good thing for us to do too. Okay, Marge, I'm sorry.
Oh, that's great. So Karen Polillo, I don't know if you want to unmute yourself and I can read what you wrote, but it would be lovely for you to tell everyone what you wrote. Karen is an RN, a clinical specialist with 3M Healthcare. So I'm going to give you that option, Karen. Well, Karen says that every surgery center or hospital needs to do a hazard analysis, for example, potential for weather issues to meet the needs of the state and Joint Commission accreditation. Karen worked in a surgery center and needed to do the analysis herself, and these tools would have been very helpful if she knew they were available.
That's so interesting. Thank you so much. We've actually started to begin a conversation with the New Jersey Hospital Administration Association in terms of how these tools might be useful. That's okay, Karen. I see you can't unmute. That's okay. How these tools might be useful in terms of some of the planning work that hospitals do. So Karen, thank you for that too. So we can definitely add that. I wasn't aware of that requirement, so that's really interesting to know.
And we might reach out to you, Karen, separately to sort of learn a little bit more, but we can certainly find out.
Yeah, and I apologize if I'm muted, just because my trash is getting picked up.
Great.
Hi, this is Carla again with Gloucester County, and this is awesome because I'll tell you what, we just had a meeting the other day on the environmental injustice piece that's going through, and if it gets approved, because we have we have a municipality within Gloucester County, Paulsboro, that is a bit of it's definitely a food desert. It's an industry that's kind of been abandoned. So they're slowly trying to think of ways through the environmental injustice aspect to kind of turn it over and try to see what they can make from it. And I just called while you guys were having a discussion. I called our director of environmental health to make sure that she's aware of all the research you're doing and what Lucas talked about and how you guys are building this website out more. Because I think this is going to help health departments and environmental health especially try to create a better environment based on what we know about climate change. So thanks. That's pretty amazing.
Thank you. Thank you so much. And one thing I'll put out there, and even though Marjorie and I are probably about 20 miles apart, she's probably going to kick me under the table, which is one thing that the Climate Change Resource Center has also instituted is what we're calling the New Jersey Climate Corps, which is a group of really expert graduate students that we're making available to provide communities with support. And the students are trained by people like Lucas and Michelle and Pripal in terms of use of these data tools. So maybe one thing we can put on our list is to try to see if we could do some pilot work with some of our students to provide support to some of the communities to be able to really, we know these tools are hard. As much as we're trying to automate them, we know they're not necessarily intuitive. So maybe there's a way that we can do that too.
That would be great because like I said earlier, we're still reeling from the pandemic. We still have COVID clinics and COVID testing that we're doing. Our workforce has dropped drastically. We don't have a lot of staff. Our environmental health division alone is down 3 people just with retirements. And we're having a challenging time filling those positions.
Great. Thank you. And I would not kick Jean under the table. I think all she's saying is that we don't have unlimited resources, but we're working on it. But that's why we're trying to make things more automated into ways in which people can use them. So Karen also mentions that it will also help infection preventionists, the Association for Professionals in Infection Control and Epidemiology. I'd love to know more about what you're thinking on that. Is there any way we can unmute Karen? Oliver, is there a way to unmute her? I think Oliver might be working on it.
Just like to ask to unmute.
Yeah, so Karen, if you go to the top right of your Hollywood square, you should, and hover, there you go. You should be able to, you're unmuted. Your microphone might be working.
Yes, we can hear you. Yay!
So I don't know a lot about it because I'm a nurse. Actually an OR nurse by profession, and I now work for 3M Healthcare. But I do know that APIC has two groups, one in North Jersey, one in South Jersey, two different presidents, and maybe they, if you could, I could probably get you the two people, their names, and to see if maybe that's something they might want to talk to you about. They do have meetings, and maybe somebody might want to join one of their meetings to let them know the resources that you have. But probably a better conversation with them just to see if this would be helpful for them. When I look at it, I'm not an infection preventionist, but as I said, when I worked in my surgery center, I was in charge of things that I needed to do, like that hazard analysis, and I really didn't really know what I was doing. So it would be helpful to have had some of these resources to help me, because it was a lot of it is community based, especially in my surgery center.
Right.
They're like, well, what's going on in your community? And I'm like, I don't know.
Right. That's great. That's super
So
helpful.
it would be helpful.
That's great. We can definitely do some follow up on that. Thank you. I think, one thing I also want to say is we are keenly aware and acutely aware of the extent to which the public health community here in New Jersey is stretched thin. And
I will volunteer that I am on my local board of health, and I know exactly what you guys are going through. So
and I'll also, in case you're not aware of this study that many of your associations, the Public Health Association, NJADAPT, Sophie, the Environmental Health Association, were involved with, is a project that we released this past December. I'm putting a link in there, which was all about how sort of assess the public health, the capacity of public health here in New Jersey, and compared to other states in terms of resources. And it's so we're really aware of that. So please don't take any of our comments here as like, you guys should be doing this, you should be doing that. Rather, what we know is that you're very constrained, especially with the pandemic, and we're developing these tools to try to be supportive, because we know you want to be working in this space. So we mentioned community health needs assessment, we mentioned community health improvement plans, we mentioned local resilience plans, we mentioned hazard mitigation plans, we mentioned applying for funding. Part of what I'm not hearing from you, like I'm not hearing a huge number of you saying, oh, I'm involved in that, right? Like I'm hearing that because you're capacity constrained, it doesn't sound like many of you are sitting around the table with hazard mitigation planners doing your municipal or county hazard mitigation plan. It doesn't sound like you're sitting around with whoever is doing your community climate resilience plan. Is that a fair thing to say? You guys can just do thumbs up, thumbs down, like, yes, we're not involved, or put something in the chat. I wish I was involved, but I'm not involved. But, just give us some feedback on that. Thank you. I have two other specific questions. I guess I'm wondering the extent to which you are involved in any work associated, thank you, Carla, whether you're involved in work with regard to the recently issued Sustainable Jersey Gold Standard in health, and whether your community is involved in that. And the reason I'm asking is because if a lot of you are, then that might give us a clue to try to work with our colleagues at Sustainable Jersey to more systematically embed use of these tools in some of that work. So give us a sense of whether you're involved in those efforts as well. I'll pause a minute. Anyone want to say anything about that?
Last I heard, I think it was last year, Hillsborough is number 2 in the state, but that is not organized by the health department. They have their own sustainability director.
Interesting.
Not to say we don't do our part, but
no, I understand. the last thing that I'm kind of wondering, whether you're all using or involved in, and I'm putting in the chat right now, and I can share my screen, is the extent to which any of you are using the data that was issued last spring by the State Department of Health, that is called the Healthy Community.
Jean, you're
Jean,
muted.
yep.
Jean, you gotta
Thank
unmute.
thank you, sorry. I'm struggling to do too many things at once. I'm here sharing my screen and trying to unmute. So just kind of wondering the extent to which you're accessing or using these data, whether this is like on your radar screen in terms of the work that all of you do, because we've been really trying to mine these data so that the best of it could be available through our tools, which we think are, you know, a little more automated. So is this something that anybody's using or working with? Is this news to everybody? No? Yes? You put in the chat if it's familiar to you.
We have a response in the chat.
Thanks, Purple. New to me. Okay. Thank you. Okay. Thanks a lot. I'll stop sharing. So Marjorie, those were the questions I kind of wanted to explore with this group. Are there other questions that you think we should explore? Oh, Marge, you're on mute now.
I'm on mute. I think we've sort of hit it. I guess my point to everyone here is we're not going anywhere. So we threw a lot of information at you, and you know, if you're walking your dog or have a long commute somewhere, and we would be happy to hear more information from you. And Carla, we see your note, and we can follow up with an email to everybody.
Yeah, everyone, you'll be getting an email from us with a survey. Again, if you've asked for CEUs, you need to complete the survey. We're asked to certify that you completed the survey, so that's your motivation to do the survey. As part of that follow-up email, we will make sure that you know where to find us. But we really do hope that this is, you know, the beginning of many conversations. And again, I guess just to emphasize, we are a resource center. We're here to be a resource to you.
And you can, and if you don't get our emails from the chat, you can just Google us or Google New Jersey Climate Change Resource Center. There's a contact us form there. You can also put your names on our mailing list, right? You can just register.
Yeah, and when we send you a follow-up email, we'll send that to you too, because as we improve our tools, we send out emails that, you know, here's a new tool, or we finally released the public health snapshot, or, you know, whatever. So that's a great way to stay in touch. Okay, Rutgers team, anything else for the good of the order?
I'm just gonna check to see if there's anybody had any other questions. If you want to raise your hand, but please don't be strangers. You've been really wonderful.
Thanks, everybody. Take care.
Thanks so much.
Bye-bye.
Bye-bye.